Associations and Radiothon Coordinator for Riley Children's Foundation. So as you know, Kiwanis has been supporting Riley Hospital, and actually Kiwanis clubs raised funds in 1919, and then that fund was a seed money for the Riley Hospital to be opened in 1924. And I've been pushing parent comfort card, Kiwanis parent comfort card since last year, and you can see lots of Kiwanis footprint in the building, so it's really nice to have Amber here today to talk about 3 wishes which we've been supporting to have early detection for the autism. But also that's coming to the end this year. So she's going to talk about what's next for the coming years. So please join me in welcoming Amber Miller.
Hello, thank you everyone for having me. It's great to be here. I really appreciate you reaching out and inviting me because I try to get out to all the clubs in the state. Although I'm here today speaking to you, I would love to offer a tour of the hospital if you're ever in Indianapolis or you want to come as a club to do a tour just to see the rich history of Kiwanis in our hospital. We truly could not do what we do every single day without Kiwanis. So thank you on behalf of all of us. So I wanted to start out a little bit about my why. Like why, of course, I love my job and love Riley. My nephew is a Riley kid, and that's actually what brought me here. I was in commercial real estate for 10 years before this, but my why changed last September. I have a 5-year-old little boy named Brody, and I have a 1-year-old little girl named Cassidy. And last September, Cassidy had a febrile seizure after my son's soccer game. Of course, it was a night where my husband had a late meeting, so it was just me with both kids. And she had a febrile seizure in our bedroom. I called the doctor, and she said, "Oh, just give her Tylenol. Come see me tomorrow." So I did, and she said that she just has a virus. She'll be fine. Long story short, Sunday afternoon, she started breathing really funky, and I try to not to, put too much pressure on myself all the time because I overthink everything as a mother, especially with all the stories that I hear. But I just told my husband that I'm not letting her go another 5 minutes breathing funky. I'm taking her to Riley ER. And he was like, okay, just go do what you have to do. So I drove fast to Riley. We live about 20 minutes from Riley, and by the time they got us in a room and on a bed, my daughter stopped breathing 3 times on the bed. So they quickly sedated her and put her on a breathing tube, and what you can see up in the top left picture. Thankfully, my son was next door playing because he didn't know any of this was happening. And by the time that he came to see her the next day, our child life team was incredible, and they quickly asked what Brody was into. And by the time I walked him upstairs, they made a little pallet on the floor. We had to be in full gear from head to toe because they didn't know what was wrong with Cassidy. So they made him a little pallet on the floor with all of his gowns and his mask. Had cars, Disney cars on the TV. It looked like Christmas in our room. He had Hot Wheels, coloring books, you name it. They made him feel right at home. He literally still asks me when we're going back to play. So for 3 days, we didn't know what was wrong with her. And I'm in those rooms a lot speaking to families, but you truly cannot even put into words how different it is when you're the one sleeping on the couch and you don't know why. So they did everything from a spinal tap to an MRI and a CAT scan on my 6-month-old daughter. And it came down to the 4th day, because we were in the PICU, we were in the ICU with kids who, you name it, that goes on in our ICU. We see the sickest of the sick kids there. And it turns out that I took her in because I thought she had croup, which is a respiratory virus. And I was like, she just has croup. We probably just need a steroid. My son's been through this. And so the infectious disease control team of 18 people walked into our room on day 4, and it turns out that's what she had. She just had a bad case of croup with a small virus that they found during the spinal tap called roseola, which usually is like a rash. But what we gained from that experience was something that I truly wake up every single morning grateful for, the opportunity of knowing that my job is truly supporting the best hospital that we could ever ask for. But what I also appreciated from that was I work closely with Marge Crouch, who runs the Parent Comfort Cart for Kiwanis. And she was waiting very patiently on some information from me. And I just texted her and said, I'm sorry, Marge, you're not going to get the information from me. This week I'm actually inpatient with Cassidy and Riley, and we don't know why. And within 2 hours, a team of 3 people showed up at that door in the middle picture with the Parent Comfort Cart, and I dropped to my knees sobbing because I might live 20 minutes away, and my husband and my son came up and visited me, but you can truly not remember everything that you need in those moments. And having the Parent Comfort Cart there, even if it's just a piece of chocolate, a loofah, some actual good shampoo, because the stuff they give you in the hospital is terrible. But just knowing that someone cares, because everyone else that walks through that door is caring for the children, and that's what their job is to care for the children, right? But when you are in that terrible spot, knowing that someone cares about you and wants to do something caring for you truly makes a huge difference. And it made me really appreciate my Kiwanis family so much more. So thank you from my family. And just to know that that cart is truly one of the most important things that we have in that hospital. So just keep that in mind next time you're traveling, or if you know anyone who's traveling and they get those travel shampoos or lotions, or if you're at the store and you just want to grab things and start collecting those things, they truly make such a huge difference. Every nurse in that hospital knows about the Parent Comfort Cart, and the days that we don't have volunteers, the nurses just come down just to help our families, and it truly makes a big difference. So thank you on behalf of my entire family. That bottom right picture, it was obviously from Christmas, but just a little update. She's doing much better. She's feisty as ever. She's giving me a run for my money, that's for sure. But she just turned 1 in March, so we've had croup twice since then, but haven't been back to Riley. But it was just a really intense experience, and truly my big why of why I'm here and why I'm thankful for you. So thank you. A little bit about Riley Hospital for Children. We are the only hospital in Indiana where children are receiving heart, kidney, and liver transplants. We also have the only pediatric dialysis program and pediatric burn center in Indiana. Riley Hospital's affiliation with the IU School of Medicine allows us to train 2/3 of Indiana's pediatricians, and we also treat 85% of Indiana children diagnosed with cancer. So a little history of the 90 plus years of service between Kiwanis and Riley. Like Taka said, you can walk down any hallway at that hospital, and the Kiwanis elevators, the Kiwanis helipad, the Kiwanis cornerstone wall. You truly have done so much in that hospital, and your work is not stopping here, and we're grateful for that. The K-wing, the elevator, the torch, the red wagon corral. So obviously the wagon, a lot of people see that wagon and they know instantly of Riley. It's our main mode of transportation throughout the hospital. You see anything from car seats with babies in them to children who are probably too big for them. But who doesn't love a wagon ride, right? So the 2 wagon corrals in the hospital are named after Kiwanis. The Parent Comfort Cart that I told you a little bit about, the bike safety program, the Magic Castle cart, which is similar to the Parent Comfort Cart, but it's for kids, which my nephew is 9 years old. They told my brother that he probably wouldn't survive and that they should consider aborting him because he would have no quality of life. He's 9 years old, deaf in 1 ear, and he's had 6 back surgeries at Riley, because we're thankful that the specialist who specializes in his birth defects, is the top one in the nation. And we didn't see him for 8 hours after he was born, but by golly, he is running, jumping, naughty as ever. And he still has the little giraffe that he got from the Magic Castle cart from his last surgery about 5 years ago. So those little things go a long way, and we truly could not thank you enough. So as far as the Three Wishes program goes, so 1 in 6 children has a neurodevelopmental or behavioral disorder. 1 in 68 children has autism or a related disorder. That is actually 1 in 60 boys. It's more prominent in boys. In Indiana, the average age of diagnosis was 63 months, which is nearly twice the national average. In steps 3 Wishes, an amazing Indiana Kiwanis, to reduce the age of diagnosis, reach all Indiana children, and raise awareness statewide. So we are very, very thankful to tell you that we are in our final year of 3 Wishes, and you've made a gigantic difference. I know that this campaign was a little harder for some clubs to understand just because a lot goes into it. So a little update. You have most definitely reduced the age of diagnosis. So 2018, the outreach to pediatric and family medicine primary care offices went out to 71 practices statewide. They offered free screening materials, education and improvement of screening methods, and identification of local community resources. So we are now up to 14 early evaluation hubs. Give yourselves a round of applause, because this started with the goal of 9 hubs, and we are up to 14 statewide. And it has drastically reduced the age. The average wait time for an evaluation is under 3 months now. That is humongous. So quick little story, our next door neighbors had a little boy 6 months after I had my son. And I knew early on that he was showing signs of autism, but that's a very tough conversation if you've ever had to deal with something like that. I live and breathe this every day, and I still couldn't have that conversation with our next door neighbors of like, has your son been evaluated for autism? So I just kept asking at his monthly checkups, because at 18 months they're supposed to do these really awkward questionnaires that no parent wants to do, like, does your child smack himself in the face? Of course, toddlers do that. They're crazy. But their pediatrician was not asking those questions and not doing those evaluations. So I just kept saying, I actually asked our doctor for a copy of the evaluation so that I could give it to them, wondering if maybe that would strike up a red flag, and eventually it did. So at his 2-year checkup, they asked their doctor about it. And very quickly he said, you know what, you should probably call Riley for an evaluation. So they called Riley, and they were told on the phone that if they haven't heard from someone in 6 months, to schedule an appointment, to call them back. That's not what any parent wants to hear. So they probably would have waited about 14 months for an appointment, but they took him out of state for an evaluation. He was diagnosed with autism. He is in 3 different therapies, and I'm very excited to say that he's been in those therapies for about 2 years now. He now knows his alphabet. He can count to 100. He knows more planets and dinosaurs than I ever knew existed. He's a very smart little boy, and he's actually going to get to go to kindergarten with my little boy in August. So that is huge that his parents never thought that that would happen. But it's because they got him diagnosed early on in those prominent years where they're learning those developmental skills. He has made huge strides. So thankfully now, also a little update. Of course, right after they got him evaluated in another state, they got a call from the Muncie hub asking if they wanted to come there for an evaluation. So those hubs are working, they're doing their job. At that time, it was just taking a little longer because you were still early in your campaign. But I'm happy to tell you that that wait time has drastically reduced to under 3 months. So that is a huge milestone and something that you all should be very, very, very proud of. So 37% were diagnosed with a new autism spectrum disorder, ASD, and 59% of those kids that have been evaluated were diagnosed with a developmental delay. New hubs in 2019, they're training 12 new clinicians. They actually did that in February of 2019. And one of the very much needed hubs that just was trained was Warsaw and Linton. So Warsaw was a huge area where there was a huge bubble around it, and they were trying to get clinicians to be trained, and we just were able to do that. So that was very exciting. This is just the map, the state map showing where the hubs are and the areas that they are seeing patients. So they've done 2,200 evaluations to date and care provided by each hub across the average of 3 counties. The goal is to spread to 5 new hubs over the next 2 to 3 years. The next goal was to reach all children in Indiana and increase awareness about developmental screening. So they did, in 2018 presentations, they did 275, and that just mentions some of the presentations that they did. And then they did a pediatric learning collaborative, which 7 pediatric practices improved efficiency and accuracy of screening in their 8th year of group collaboratives. And then to build expertise close to home, they did a mini sabbatical with 6 pediatricians from Anderson, Indianapolis, Lafayette, South Bend, and Warsaw, all with the Kiwanis funds, to increase skills in ADHD, anxiety, depression, and autism. So they did classroom workshops, monthly learning collaborative and case conferences, which was web-based, and clinical practicum session this spring. And then they participate in state projects like the Early Childhood Comprehensive Systems, Early Learning Advisory Committees, and Help Me Grow Indiana. That's just going to show you that it's not just happening, in central Indiana. This campaign has truly reached all Indiana children statewide. So then a new thing that I try to give a little update of Riley Children's Foundation, because you don't know what we're working on if I don't tell you, right? So we had a lot of people tell us that they wanted to give to Riley. Riley has impacted in one way or another, but they just didn't have the money right now. So we rolled out our 1924 Society recently with immediate gift opportunities for appreciated securities, which you can increase your support by donating stocks or other assets that have gone up in value, or IRA charitable rollover. And the benefits, the simple deferred gift opportunities through a bequest, which is through a living will or a living trust, or beneficiary designation of retirement plan assets or life insurance proceeds. The benefits of deferred gifts, of course, are gift to charity, estate tax deduction. It preserves lifetime flexibility, and it's easy to implement. So basically, you could add it to your will and say, 3 wishes was important to me, and add it to your will, and it would still benefit 3 wishes. It's the easiest way to know that your money is actually going right where you want it to within Riley. And then last but not least, we rolled out the Be the Hope Now campaign, the goal to raise $175 million by 2020. Our main 3 high priority programs are pediatric research and patient care. So one very important note, you donate every $1 donated to research at Riley at our Well Center for Research, which is attached to the hospital. Every $1 donated turns to $10 in grant money. So it's the best return on investment for sure. Maternity and newborn health. So like Taka mentioned, we are rolling out a new campaign in October. We're super excited about it. We will be fundraising for a maternal fetal medicine specialist. So at this time, mothers cannot deliver their babies at Riley. They are delivered at Methodist Hospital and transferred upon birth, which means mom is separated from her baby and oftentimes does not see the baby until day 2 or 3, which I cannot imagine. Hopefully by the year of 2020, that will change, and we will have the ability to deliver babies right at Riley. We will have 3 different NICUs, anything from high risk to just hopefully any mother could deliver their babies there. Indiana is actually 8th in the nation for infant mortality rate. We are parallel to some third world countries. So it is a huge problem, one that a lot of people do not know about. So we're really trying to tackle that, and Kiwanis is going to be a huge part of that. So anytime that you see those commercials about maternity and newborn health or this initiative, just know that you are about to be a huge part of that. And then last but not least, the family support programs, which includes Child Life. A lot of you know about, you fundraised for Child Life several years ago. We are blessed with 27 child life specialists at Riley. We have more child life specialists than most children's hospitals nationwide. And they really make Riley special, meeting with patients and siblings and parents with the medical play to try to make their experience a little more comfortable. So thank you. That's all I've got for you. Does anyone have any questions? This is a record. No one has questions.
Why is our mortality rate so high? What are some of the reasons?
Safe sleep. A lot of really bad safe sleep habits of just putting things in the crib and, SIDS, sudden infant death syndrome. But the biggest problem, honestly, is the mothers not getting the care that they need in the first trimester. The rate, the percentage of women who don't even see a doctor the first trimester of pregnancy is way too high. So they're really trying to get the knowledge out there of getting the health care that women need and making those appointments and making sure that they are being seen. They're doing a lot of telehealth now where there are certain pockets of Indiana where mothers are saying they don't have the transportation to get to appointments or they're not close to a hospital or close to a doctor's office. So they're actually calling into appointments or doing video conferencing. So we're really trying to nail down ways and opportunities for the women to get the care that they need. That was a good question. Any other questions? Oh my goodness. Okay, I'm going to write this one down.
We probably, because we all probably visited our accountants, tax accountants, or some of us did our taxes on our own, but this is an interesting year, and, in talking to the accountant, that's because of the changes in deductions for giving, some folks cluster their giving into every other year to try to go past the standard deduction that they're giving. But you'll be seeing more and more things from places that you give money to about giving matured stocks. You take your stocks out, you can't remember what your basis was on half the time anyway, but you can give those directly to organizations as well as that required minimum distribution. I mean, if you're at a 28 or so tax rate, you take out $10,000, $2,800 is going back to pay your taxes. You could as easily give that if you were planning your donations to someplace else, and they get the full amount, and you get that credit for having made a donation.
Right, and you can even do as little as 1%. You'd be surprised, what 1% could do for an organization just through your will, and that's what we're finding of people. I have a heart for Riley. I've been so dedicated. I wanted to do something, but I just don't have the money. And just calling and making that 1% really makes a giant difference in our numbers and making an impact because we're pushing hard for that $175 million to make it possible to open the maternal fetal medicine hospital, but we're not there yet. So every little bit helps, and I really honestly cannot thank all of you enough for all that you do. So thank you.
How does Kiwanis support compare with other organizations that support the hospital?
So Kiwanis is the only association in the state of Indiana, A, that was fundraising for the hospital before it opened, and B, you're the only association that gives every single year. I work with associations statewide, so I can tell you that other associations bounce around who they support, which is very scary for us because we can't support, for example, a child life specialist who 80% of their salary is paid for by donations only. Insurance does not pay for it. So we can't guarantee a child life specialist's salary every single year based off association donations because we don't know if we're going to get that money every year. Kiwanis is the only standing support from an association that I see statewide. And it's not just monetary, it's the pushing the volunteer cart through the hallways, it's donating those little supplies. There honestly is not another group like Kiwanis. And I'm not just saying that because I'm standing here, I can promise you that.
Thank you very much.
You also cannot walk through the hospital and find another association's name on any other place other than, there might be like one-offs. But everyone in that hospital, anytime I give a tour, they're like, oh, that's Kiwanis. We see their name all over the place. So every employee who's been there for a while, everyone knows Kiwanis in that hospital and are truly appreciative of you. Even the security guard, I can tell you that.
Thank you.
Thank you.